Now, good evening. Thank you so much for coming in at such late notice. That's absolutely right. I did. I'm sorry, but I read your notes and I just thought I don't want to leave you any longer. I'd like to see you face to face and we can have a good look at what's worrying you. Does that sound all right? Good. Good. Excellent. All right. Well, I'm going to go through a couple of notes with you in a moment, if that's all right. And we'll just check over your existing notes to make sure that everything is as it should be. Wonderful. Right. Can I just check with you? Are you still on the same telephone number ending 985? Okay, yeah, lovely. Alright, that's great. And your address is the same? Lovely. Yeah, wonderful. No, I just need to check. Medication, are we still on the same as we were before? I have here 25 milligrams, correct? Okay. Alright, and you feel happy with that? Good. Right. I'm more than satisfied with all the details. The reality is I've been looking over your notes. I want to have a chat with you today. That's it. It's this skin condition you've been talking about. Right. It says here that it comes and goes, correct? Okay. And how does it make the skin feel? Tell me. Are we having a puffy sensation when we're pressing on the skin? Is it itching, sore? Have you had any open wounds? Tell me. Right. Okay. Yeah. Well, I'm going to run a series of tests today, if that's all right with you. Brilliant. Yeah. No, please, I assure you. Together we will have this sorted in no time at all. It might just take a little bit longer. If you don't mind, I'm just going to give these a wipe down, and I'd quite like to get in a bit close to begin with. Alright, as I said, I'd like to get in a little bit closer and have a really good look at your face. Alright? So if you don't mind, just for your comfort and mine, when I'm very close up, I'll pop my mask on for you. Will that be okay? Alright, we can take it off later, but right now, there we are. Okay. Can I just look over there for you? Right, and this side. Okay. There is a slight discoloration. Bear with me a moment. Can I just, would you turn your head to, that's it. Turn your head the other way for me. I'm going to need to really look there at what I'm doing. Alright. And just turn your face. That's it. All the way over. That's it. All the way over. Let me just hold you there. I see. Right. Alright. Okay. Let's have a look. Now, I'm going to do a series of tests with you. So, we'll begin with a gentle touch test. Are you okay with that? I think I've done this before for you, haven't I? Yes, I think I have. You're a very good patient then. Now, can you please tell me, as I gently touch the areas, if there's any discomfort for you? Alright? I don't want there to be any discomfort, so please, if I touch on anything that feels particularly tender, you make sure you tell me, won't you? Good. All right. I'll just go in at first with one finger. I'm going to go in on the left-hand side. There we are. Do you feel that? Good. And I'm just going to press, press, press. Okay. Coming in on the right with a gentle press. Well done. Press. Any discomfort yet? Okay. Press. Alright, I'm going to come underneath a little if you don't mind. Let's just get, there we go, pressing gently there. How does that feel? Can you tell me? Do we have any tingling sensations? Right. Any skin that's pulling particularly? No, okay. And what about when I take two fingers in and I just give a gentle push? How does that feel? Alright, and this side? Push. Good job. A little bit higher. Push. How is that feeling? Can I'm just going to stroke your hair a little. That's it. Is that alright? It's not sending any tingling sensations down the body? Down the neck at all? Alright, well if you don't mind, I'm actually going to run my fingers around and down your neck. Oh, okay. Well, a little bit tender there. Let me see, a little bit more. Let's check this side, a little bit more tender there. That's alright. So it seems that you're a little bit more tender on this side. Okay. Alright. Let's do some further investigation, shall we? I'm going to take this off now because we're going to step back a little. Is that alright with you? Lovely. Just take these gloves off. Finish with that examination. You're doing very well. I know how anxious you can feel sometimes when you're having to come in and see me. I wish you wouldn't, you know. Got nothing to worry about. No, nothing at all. Now, next I'm going to have a little look in your eyes. Are you alright with that? Good. Alright. I will need you to lay your head back a little for me. Is that okay? Oh, good. Now, I remember that you suffered slightly with vertigo for a while, but you're over that, right? Yes, the medication I gave you worked? Wonderful. Good. Well, let's have a look now. If you can help me out, we're going to use the white and the blue gloves. You alright with that? Lovely. Alright. I'm just going to pop a little light on. You'll see the little light pop on. Do you see that? Alright. When you see the light, I'd like you to follow it and follow the glove. So if I ask you to follow the white glove, please follow the white glove. If I ask you to follow the blue, please follow the blue. Alright. Are we clear on that? Wonderful. Okay. You're not getting tired, are you? Good. Well, that would affect my results, and I don't want you to be tired within my company. No, not at all. Not just yet, anyway. Eventually, I'd like you to be very sleepy. Yes. Okay. Are you ready? Okay.
I would just like to say
when you're ready,
a very big thank you for watching today.
Blue or white, okay? Can you follow the light for me? And first of all, I'm going to just do a little examination.
Please do.
Just give me a moment. Can I just open that eye a little? Just open it a little. There we are. We just get in there. Have a little look.
OnlyFans page.
Okay, no, that's fine. Absolutely fine. On the other side, I'm just going to squeeze squeeze your eyelids open. Well done. Just squeeze the eyelids open a little. That's it. Hold it there for me. Just squeeze them a little for you. Brilliant. No, that's okay. And you're not getting any discharge or any weeping from under the eyes. All right. Even in the mornings? You're fine in the mornings as well? Yeah. Okay. All right, that's not a problem. So we're just going to run the tests now. Light on. Lovely. Follow my light, please. To the left. Very good. Follow it to the right. How many fingers am I holding up? Well done. I'm going to bring my fingers back now. Concentrating on the light. How many fingers am I holding up? Excellent. And now, good job. I'm going to bring the light down to the right. How many fingers am I holding up? No, you're doing fantastically well. I'm going to be doing the same examination on the other side. So, watching the light for me. Have you got the light? How many fingers am I holding up? All right, lovely. I'm bringing them back now. Concentrate. How many fingers am I holding? Lovely. The light's going to come closer and the fingers are going to come further apart. How many fingers am I holding? Wonderful, good job. All right, let's just bring that hand forward. And now, yes, that's correct. Good job, wonderful. All right, I'm quite satisfied with that. I don't think there's any irritation around the eyes, not that I can see. The eyelashes don't seem to be sticking together at all, so that's excellent. Now, let's look at what we're going to do next. If you don't mind, I was just pulling the eye, can I? Just press the skin around the eyelid. That's it. Now you can close the other eye if you wish. You can keep them closed. I'm literally just seeing how tense the skin is around the eyes. That's it. And you've not noticed that you've lost any hairs on the eyelid, eyelashes or eyebrows at all. Okay. No, well that's fine then. No, that's absolutely fine. You really are doing a very good job. Are you feeling alright? Can I get you some water or anything? A cup of tea while you're waiting here? Alright, well, that's very good. Okay, now can we have a look please? I'm going to be going in a little bit closer around your throat, so I'm actually going to be pushing your head up. Are you okay? Just want to push your head back and over, alright? Have you got that? Back and over. Hold it there for me. I'm going to be coming in a bit closer. Hold it there. Please hold it there for me, don't move. You'll feel my fingers gently around your throat. Just doing a little gentle pressing, a little gentle tightening. Nothing too vigorous. You'll feel my white glove pressing gently. Good work. And then you'll feel my blue glove pressing gently. All right, I want to just, can I just, that's it, I kind of need to get in a bit closer and massage around the back. Yes, that's it. I want to check your tonsils slightly. No, lymph nodes are okay. All right. Well, I'm pleased to tell you that your neck, throat and your nose even seems to be quite clear at the moment. Although saying that, if you don't mind, I am going to come in a little bit closer again. Just come here. Just want to boop your nose, just gently. Boop. Is that okay? Is that alright? Tell me if you feel any strain through the sinus area. Boop. No, that's good. Boop, boop. Okay, are you ready? Boop, boop, boop. How did that feel? Any tingling? No. Alright, I'm going to do it one more time. This time take a big breath in for me. That's it. Hold it in. Are we ready? Boo. And breathe. How's that feeling? Anything? No? Well, there's nothing to indicate that this is going to be a long-lasting condition at present. While I have you here, do you mind if I just do a quick check? Very quick check on your heart. Yeah. I'll listen to your chest for a minute, alright? Alright. That's it. If I could just get you to raise your t-shirt. Raise that up for me. You hold it for me. That's it. Now, I'm going to ask you to breathe for me. And what I'd like is for you to breathe as I explain. Okay? Alright. Let's start together. Are you comfortable? I'm going to warm that up for you. I'm going to put this on your left hand side and you'll feel my gloves wiggling. That's it. I'm just going to hold it there. Now, can you breathe in for me? A big breath. Take it in and hold it for me. You're doing fantastically well. You can let it out. Lovely. This time, just breathe normally. In and out. In and out. In and out. Keep breathing normally. In and out. In and out. Alright. That sounds good. I want to go to the other side now. So you'll feel the same thing again. We're going to do a big breath first, please. Okay. Alright, it's warmed up. You'll just feel my glove holding it in place. Alright. Big breath in now, please. Hold it there. Hold still and quiet. Alright, you're doing so well. Still and quiet. And breathe out for me. That's it. No, you're doing fine. This time, if you remember, just regular breaths. Alright, you'll feel my glove once again holding it in place. And breathe. In and out. In and out. Just regularly. In and out. Keep going for me. Actually, it sounds very, very good. You have a lovely, strong, healthy heartbeat, so that's not worrying me one bit. Now, can I ask you, is it alright if I run my gloves through your hair for a minute? Because I would like to see if there's any tingling sensations running around to the back of the head. Would that be okay? Good. You're being very patient with me. You're a good patient. Alright. I'm going to can I just position your head a little? You can move yourself, that's it. Move yourself over this way a little. Just pop yourself there. I like that. Okay. Staying where you are, you'll feel my gloves start from the front of your head. They'll begin to tap gently. So you'll feel it initially along the temples, alright? Alright. I'm going in on your temples and you'll feel very gentle tapping. Got it? I'm going to move around to the back. That's it. Please tell me if you feel anything a little bit strange. How's that? Can you feel each of my fingers? Let me go through them. 1, 2, 3, 4. Can you feel those? Alright, and what about when I press my thumbs in? Do you feel those? A little bit harder. I'm going to press a bit more firmly now. Yeah, do you feel that? Just a little bit harder now. Okay, alright, I'm going to bring those tingles back. Let's go. Bringing you back. 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4. Last time, round to the front. 1, 2, 3, 4. That is wonderful. Now, were there any areas that you felt particularly delicate there? You did. I thought so. I actually felt you wince slightly. I want to go back to that again. So I was about here. Is that right? Okay. Just behind the ears, yeah? Okay, and when I press there? No. What about when I press in there? Yep. Yeah, I felt that. And a slight bit of tenderness and a little bit of swelling there, which is unusual. Wasn't there before? No, I didn't think so. Alright. Now can I ask you some general questions about your health? Because obviously I appreciate that this is affecting your face, but often you can find that this type of thing can stem from many parts of the body, and the gut being one of them. So, honesty now please. What's your diet like at the moment? No, honesty is the best policy. Can I just write that down? Just bear with me a moment. I'm just going to take these off. What I'd like to do is just take a couple of notes on what your diet's like, alright? Okay, now remember, I'm not judging, I just want all the information so we can make sure that we have you feeling the very best you want to be, okay? Alright. Okay, so can you tell me, what does breakfast look like, please? Right, so cereal or toast? Okay, so it's carbs or carbs, right? Okay, and no fruit or yogurt? Right, okay. Now, do you eat again between breakfast and lunch or straight to lunch? Right, okay. And what would lunch look like on a working day? Sandwich. Okay. So far, on a recap, we have toast or cereal for breakfast with a sandwich. So some carbs with a little bit of carbs and some carbs on the side. I think we're going to see a repetitive theme here, aren't we? And again, do you eat between lunch and dinner? Yeah. Yeah, no, that's fine. I mean, you have a long day, so most people usually end up having something at 3 o'clock. I'm rather partial to a biscuit and a cup of tea, actually. But don't tell anyone. Oh, unless you want to bring me biscuits in next time, obviously. Okay. Continue. What are we having for snacks? I mean, I want to hear you say you're having a piece of fruit, but you're having a chocolate bar. Yeah, I had a suspicion that's where we were going with this. All right. And dinner? Okay. Are we having any home-cooked dinners through the week? Well, I would like to see that improved. And even if that means that you're stopping on the way home from work and getting yourself something with a little bit more nutrition in it, I think that would help. Now, I'm certainly not saying that this is completely diet related. However, I would like you to make a couple of changes for me. Yeah, and these will have an overall health benefit to whatever you're doing. So, can we swap out in the morning that morning option of cereal or toast? Is there any chance we could perhaps do yogurt and fruit in the morning? I mean, you can still grab it and run. What do you think? Could you try it for a month or so for me? Well, thank you. I like that. I'm pleased that you're willing to do that. Alright, we'll make that a simple change. I'm not going to ask for any more than that, apart from a few more home-cooked meals, please. Less takeaways, alright? You know the salt content in those? It's diabolical, and I don't want you back in here with other health conditions. Okay. Alright, well, let me just see. I've got one more test to do. Now I don't want you to be worried by this, please. I'm going to be putting on a very slightly more industrial pair of gloves for this. You'll see here. Yeah, they're quite strong and rigid and long. But I really don't want you to be worried by that. That's right. No, they're made of rubber. They're not the latex ones that you had earlier. Well, what I'd like to be testing, actually, is your reaction to them. Because I have a suspicion on what may be causing the issues here. So, let's have a little trial, shall we? Alright. So I'm just going to take this glove and I'm going to squeeze that on, and you'll just see me here sliding it up to my elbows. Alright? I know they look a little bit nerve-wracking, but you've got nothing to be afraid of, I can assure you. No, it's absolutely fine. You'll see me do the same with the other. Just going to slide my hand in. They're quite a smooth glove, so they're not going to hurt you in any way. Just raise it up over my elbow. Alright, now we'll start with the simple test, where I just go in and you'll feel the 1, 2, 3, 4 finger test, okay? Alright, let's try that first, please, if you don't mind. Ready? Let me have your head in my hands, please. Alright, from quite a distance you'll feel. Ready? Good. 1, 2, 3, 4. Wonderful. Bringing it in closer. 1, 2, 3, 4. Once more. 1, 2, 3, 4. Alright, do you feel that around the back of your head? Yes? And how does that feel? No, okay, it's no problem. Just going to release that grip. Alright. I'm now going to come down and do your throat, okay? Alright, if you don't mind, let me just smooth my gloves down. That's interesting. Very interesting. Yeah. Very interesting. Just going to put both of my hands around. See them both here? Alright, they're both going to come around each shoulder. Feel a small amount of pressure. Do you feel that? Alright. Are you feeling okay? Good. Okay, we're going to feel me just rubbing. That's it. Okay, can I do the other shoulder, please? Let's have a little look at that. Both gloves, you'll feel them coming in and around, and they'll be gently massaging and rubbing around the shoulder. You've got quite a knot there. That's a difficult one. Yes, that is quite a tough one. Now, let me tell you something that I've noticed. Interestingly, where I've touched you with the rubber, you're getting a lot more pinkening around the skin. And I have a suspicion, tell me if I'm wrong, your work gloves are rubber, correct? Just as I suspected. It's quite an uncommon thing these days, but very occasionally, and certainly if you've been working with a product for quite a long time. Do you mind if I continue checking? Yes, if you've been working for quite a long time, you can develop an allergy. And I think that's what you've done. I think over time what's happened is you've simply developed quite a strong allergy to the rubber. No, of course you can't not wear the gloves because you need to work. But what I did explain, as you saw, is that whilst the rubber was a problem, the latex wasn't. So I'm going to make a suggestion for you. All you'll need to do is get yourself a nice latex glove. You can buy these by the pack, you could even order them from myself, and pop one of these on before you put your rubber gloves on. How does that sound? Simple as that. Try it for a little while, and obviously, most importantly, can you try not to touch your face, because I do appreciate it's hard, dirty work and you're swiping across your head. Well, if you take a look in the mirror, you have a little bit more reddening here, which tells me you do that. I realised I did think so. Okay, I'm just going to clean my hands again. Alright, well, I think we've probably found the culprit, and I'm very pleased to say that I'm not going to have to prescribe you anything to actually fix it. However, we are going to have to monitor it. So how about I book you in for 2 weeks' time, and in the meantime, if there's any worsening or anything that you're worried about, I absolutely do not want you worrying, alright? No worrying for the doctor. Alright, well, if you are worried at all, you just ring up immediately. Tell the secretary that I said it's absolutely fine to just put you straight through. Yes. No, any time. And if you can't get me on the day surgery, please do email in. I actually get those and I can respond to you. Good. Well, I'm so happy that you're feeling a bit more confident now. I know you were very, very concerned. It's easy to let the mind run away with us, decide that we've got the worst diseases that known to man, and you don't. You really don't. You're absolutely fine. Good. Well, it's very late and I ought to let you go, as when you came in, I did say you weren't looking too tired, but you are looking quite tired now. Ready for your bed, I think. Ready for a good night's sleep. Good. Well, I'll see you in 2 weeks' time. Happy listening, my darlings.
I would just like to say a very big thank you for watching today, and I hope you've enjoyed. And if you have enjoyed and you like any of the medical content or any of my roleplay, please do like and subscribe. And for any of my more grown-up, maybe more explicit stories and roleplay, please join me on my Patreon or OnlyFans page. Happy listening, my darlings.